Bore da pawb, good morning everyone. My name is Judi Rhys. I am an independent member of Public Health Wales, and it's my real pleasure to be here chairing the seminar today in this magnificent venue. If we do get bored at any time in the day, which I'm sure we won't, we've got some ceremonial spears at the back there that we can, I'm sure, have a game with. I've got some housekeeping things, as you'd expect, to run through. I'm told that there isn't a fire alarm test planned for this morning, which is a good thing. If it does indeed go off, my notes here say run, but I'm sure that to be a little bit more specific than that, we'll go out of the room, down the stairs and out of the front doors where the car park is, and we congregate in the car park. But I'm sure there'll be staff on hand to help us. Just follow me, because I'll be first out, so that's fine. If you do need any assistance during the day, please ask one of the team here who will help you. So we have Mary Griffiths, if you make yourself known. We also have Jamie Wyatt, who may still be outside. Or yeah, she's out on the desk there, and they will help you if you need anything at all during the day. I need to, obviously, I'm sure most of you will have found the toilets, or as they're very quaintly called here, the ladies' and gentlemen's lavatories. So well worth a visit if you haven't already been there. But they are through this door, just down the stairs and to the left. That's right, to the left. We have a photographer, and this session is being videoed as well today. Photographs will be taken throughout the day by the team for future use. So, and we're recording the event today for posting on the network's website. And we're also doing some live streaming via Twitter. If you have any concerns or queries about that, if you shouldn't actually be here, for example, and then please see Sorin, who's here, who will obviously respect your confidentiality. Okay. Sorin is also live tweeting on the Public Health Network Cymru Twitter account today during the seminar. So you can follow that at PH Network Cymru for updates. And if you're tweeting yourself, you'll see the hashtag there, AHP Cymru 2018. We have got Wi-Fi here today. If you click on it's the Swansea Council Wi-Fi, click Get Online, and I've done it on 3 of my devices so far, and it seems to have worked. So good luck with that. We're going to be having 3 presentations this morning, which I'll be introducing. And following that, we have a session which is a Mentimeter session, which I'm sure some of you will be familiar with. You will need your device for that, your phone, tablet or laptop, to participate in real-time questions and responses. Malcolm, at that time, Malcolm Ward will introduce that as and when we get to that particular session. All important lunch and all other refreshments will be served in the top foyer, which I believe is this way during the day. So that's it really in terms of all the various housekeeping things that I've been required to share with you. And I will be introducing the presentations shortly. We will take all the presentations, and then there is a session for question and answer. So please keep your questions for that so we can deal with them all together. So before I hand over to the first speaker and introduce our first speaker, I just wanted to reflect really on my own understanding of allied health professionals' contribution to public health. And during my career, I've worked in various settings alongside, sometimes very closely with a variety of allied health professionals. So I really have a sort of a close understanding of the particular role that you can play. My early career was in health promotion, and I particularly worked in the fields of nutrition and oral health. And as such, of course, worked very closely with dietitians at that time, very much around sort of setting up some, quite groundbreaking programs around nutrition and oral health way back when. And when I worked for a while at the Open University, I was there at a very exciting time when we were setting up the Faculty of Health and Social Care And that was the real time, I think, when allied health professionals' career pathways were really maturing at that stage. And it was really noticeable to me, working with allied health professionals at that time in that setting, of the real understanding of the importance of working across boundaries. And I think that's probably a theme, across all of public health that we'll be developing today. And then more recently, my career over the last 12 years or so has been in the third sector, mainly around working in long-term health conditions. And clearly through there, I've come into contact with an awful lot of allied health professionals, really working very closely in terms of having that population-based approach to the work. I should also say that personally, I'm just coming up to my 40-year anniversary of living with diabetes. Again, that has brought me, as you can imagine, into contact with quite an array of allied health professionals who have certainly helped me personally along the way. And I'm also a bit of a runner. Thank you very much to the physiotherapists and the podiatrists in the room today who kept me on my feet and kept me moving. Public Health Wales, as you know, or you probably know, is in the process of developing a 10-year strategy, which is a wonderful time to be involved as an independent member. And it's really apparent to me that there's a lot of enabling legislation there to help us in our path to promoting public health for the population of Wales. Our groundbreaking Wellbeing for Future Generations Act, for example, is really, really important in setting that framework. And the 5 ways of working that we're really embracing at Public Health Wales: integration, involvement, collaboration, prevention and long-term thinking will be things that you as allied health professionals will really understand and really be able to get behind. And that's so important. The Social Services and Wellbeing Act really focuses on that person-centred approach, which is so important for the people that we're here to serve. And I think that further integration of health and social care delivery that the Act is promoting, the idea of co-production and being really person-centred, is something that sits very well with you as allied health professionals as well. And I know from my experience, both professionally and personally, that allied health professionals really understand these ways of working and the person-centred approaches, and you're certainly well placed to take up the public health challenges that lie ahead of us in Wales. So I'm really looking forward to a stimulating and thought-provoking day today, and thank you so much for you all for attending. So that leaves me with the pleasure of introducing our first speaker, who's Dr. Gill Richardson. And Gill has worked in the NHS for over 30 years as a community child health doctor, GP and lecturer, and then consultant in public health. She was the director in public health for Caerphilly Local Health Board, then an Iron Bevan University Health Board from 2003 to 17. And Gill has international health experience in North and West Africa, India and Hong Kong, represents NHS Wales on the National Refugee and Asylum Seekers Task Force, and she's published widely. Gill is the Deputy Director of Policy Research and International Development at Public Health Wales, and it's my pleasure to welcome her to talk next. Thank you.
So every one of these professionals is essential for the care of our patients here in Wales, and for population health. There is an incredible opportunity for each individual practitioner who's represented in this list to relate to the individual in front of them, and also to their professional group and to the people that they're in contact with professionally, with their colleagues. So, we are all here with the same aim. We want to improve the health and the well-being of our patients and of the people of Wales. We want to use interventions that are effective, that are based on evidence, and achieve good outcomes to optimise everybody's potential, so that each person we're in contact with really does make the most of their abilities and that we can enhance them. So we have a joint mission as well. And the mission here is from Public Health Wales Strategic Plan. But I hope that you can also identify with it and that it chimes with your mission. What's your mission? You know, the mission that gets you out of bed in the morning, the mission that brought you into your profession. So, improving the health and well-being and reducing health inequalities is a really key thing for all of us. Improving the quality, the equity and the effectiveness of healthcare services, and protecting people from hazards which may be infectious or environmental. That's what we deal with in Public Health Wales, but also other hazards as well. So if we think about public health, we frequently think of it in three domains, and that is health improvement, health protection, and healthcare service improvement. So improving health would include all of these here, looking at interventions which might be ranging from brief advice to more motivational interviewing, and they could encompass a whole range of things such as weight management, smoking, exercise and health and nutrition, alcohol and substances, and also point us to the foundation level for mental well-being. And you've probably heard us talk quite a lot about making every contact count, and many of you will have actually been champions for that approach in your organisations and in your workplaces. Also exercise referral and social prescribing. Social prescribing is really coming into fore, I think, at the moment, and means different things to different people at the moment. So perhaps we do need to think about a common definition, but I think of social prescribing as basically extending where healthcare cannot help somebody into connecting with other services. So perhaps it would be the lifestyle services, but perhaps it would also be things like debt counselling or problems with low-level mental health, etc., motivation, and joining up with employment programmes as well. So there's a whole host of life improving measures that we can take together as practitioners. Healthcare quality, again, very important. So ranging across the whole of the care spectrum in Wales. And we're very fortunate, aren't we, in having these integrated health boards. And I think that, you know, across the UK, people do look to Wales at the moment and think, well, they have an amazing opportunity for all professional groups, really, because it is absolutely a cradle to grave and everything in between service. Maybe not as integrated as we would like in places, but I do find that amongst people I meet, the therapists in particular, and the allied health professionals are working across those previous boundaries in a way that others aren't. And the barriers are really quite artificial for them. So they are really, an exemplar for the rest of the NHS, I think. And then health protection. So obviously in Public Health Wales we're very concerned with immunisation and prevention of infectious diseases, screening to detect early cancers, also sexual health and drug and alcohol misuse, and health and safety. But health protection is part of all our roles wherever we are, and there are aspects to every practitioner's role that will include health protection. So what are the national drivers? Obviously the Welsh Government has recently published the strategy, Prosperity for All, and within that is the Healthy and Active strand. And our mission, if you like, chimes very much with that, improving the health and well-being for individuals, families and communities in Wales, so that they achieve their full potential and prosperity in a very wider sense, not in economic terms, but prosperous and flourishing as an individual or as a community. There are three objectives in the Healthy and Active theme: delivering quality health and care services, promoting good health and well-being, and building healthier communities and environments. And again, this document talks very much about integration and collaboration, which is something that you as professionals are very much at the forefront of, certainly in my experience. Other national drivers, you all know about the wellbeing of future generations, and you've probably seen that pizza and can name all its parts. But part of that is obviously the Healthier Wales wellbeing goal, and that includes physical and mental wellbeing. And the vision really is of a future in which choices and behaviours that benefit future health are understood and are encouraged, and very much looking on the 5 ways of working, which it's something that NHS professionals really have embraced. Okay, so just the story of me now. So this is my mum. She is going to be 80 on May the 31st, so quite an occasion. We'll probably have a family get-together, as we did for her 70th. And she has been a very active lady all her life. She had children fairly young, so she didn't actually have much of an education, but she was very active in the community. And then later in life, when my brother and I were a little bit older, she took up employment and was a school dinner lady. Unfortunately, on a 0 hours contract, you know, understand, and unfortunately, no pension. But my dad is financially okay, so she's okay. Between her 70th birthday and now, she actually had a stroke, and it was on a bank holiday weekend, and it was in Chester. There was no stroke pathway at the time, so it was a real journey, and interesting for me, coming from a very long history of experience in the NHS, both hospitals and GP, to observe it from the other side. And I have to say that, you know, the allied health professionals that were involved right from the beginning of Mum's care were just fantastic. And often when medics were too busy, or nurses had lots of things to do for, you know, many patients, it was the therapists and the allied health professionals who would sit down and explain and who would help her. She completely lost all her speech. It was a very dense stroke. She had a hemiplegia. And it really was, you know, we didn't know was she going to survive. Thankfully, there was a on-the-ball speech and language therapist doing a swallow test very quickly. They also got her, you know, very simple communication aid that she could point to, just a piece of paper with drink, food, you know, toilet, just really basic things. But that made her life bearable, because she was trying to write things down for us and we couldn't understand. She thought she was writing words, but they were basically Egyptian hieroglyphics. So, but she did recover, and so, you know, glad to say that at 80 soon, she's off to see Wicked next week with her Women's Institute. She plays bowls all summer and is very active, and, you know, is quite a fit and active lady now. And the speech occasionally goes at the end of the day. She can't find a word, or she's mumbling when she's tired. But, you know, that too came back, and that was as a result of a lot of therapy, physiotherapy, occupational therapy, aids and appliance advice in the home, podiatry, you know, all kinds of things. So I'm indebted to allied health professionals on a personal level, but also it made me think about the real opportunities that perhaps were there earlier in Mum's life, where she perhaps might have had some advice. She had smoked, she doesn't now, but she had smoked. You know, perhaps she hadn't been physically active as she could have been. Maybe her nutrition, she would look after us as family, we'd all be encouraged to eat our vegetables, but she wouldn't. She'd just have the bacon sandwich. So, in a way, it made me think that perhaps there were lost opportunities. You know, when she was going to her regular podiatry, and when she was going to see her GP and saw other professionals in the surgery. So that was quite a challenge as well to me, that perhaps there had been lost opportunities that my mum, who probably wouldn't listen to, you know, her family, who were medical, would have listened to the podiatrist. But anyway, she's a lot better now. And that is Krispy Kreme donuts, and I apologise now, Mark. Okay, so as Judith will outline later, and as you all know, there's a public health strategic framework for allied health professionals, and that's really important, and it includes the strategic approaches of aligning to national public health priorities, and also aligning with directors of therapy and healthcare science, directors of public health, and directors of primary care and mental health. And these public health priorities, it's suggested, will be integrated into leadership and service redesign and feed into workforce development priorities. So wouldn't it be amazing if in all our training we were taught how to help people like my mum or people like those that you know that would benefit. It's not an easy thing, raising things with a patient or a client when they haven't raised them themselves. So really, just to summarise, I think that better together sums it up. As professionals in the room, you are an incredible voice. You have so many members of your professions that actually, you are the most populous group of healthcare professionals, taken as a whole. And that, you're already in that space of collaboration and integration. Nobody's having to tell you these things. In a way, you're already there through your training. You already collaborate with health professionals widely and together. And then the long-standing relationship between us, between public health and between your professions, are built on shared values actually, and on shared knowledge. So there's probably much more we could do in terms of research in population health approaches, and there's definitely more that we can do in learning together and coming up with new strategies together for our professions. So a challenge really for you, because you in this room are probably the ones that are already there. You're already in a very enlightened place. You know and can understand the incredible impact that you could have on the NHS. But not everybody is in that space. So please, a plea, I guess, to go back and when you have in your own minds got clear what message that you need to give your profession and your colleagues, please go and champion the cause for your role in public health. Thank you.